All of you. Okay, let's try one by one and see if it's all okay. Asia, can you say something?
Hi, I'm Asia from Vietnam.
Great. Excellent. Sean?
Hi, this is Sean from Taiwan.
Excellent. Raymond? Oh, God, he's on the phone still. Okay. Billy?
Hi, this is Billy from Korea.
Excellent. And then Raymond?
Hello, can you hear me?
Yes. Okay. All loud and clear. All right. Wow. So the voice is okay. Let's see for your presentation. Asia, can you try
very
to
honored to introduce
share your
one of the
screen?
leaders behind the K=K program in Vietnam, the
So
first
I'm getting
national
some
youth
feedback.
program in the world, which I was so honored to be able to visit the summer before last. Miss Asia Nguyen, MA, who is a health systems advisor for the DGHT US CDC Vietnam programs since 2010 and supports PEPFAR's Vietnam's health systems programs and activities. She supported the transition of CDC-supported Vietnam HIV programs to social health insurance and assisted in the scale-up of routine viral load testing in the country. Recent initiatives include the design and implementation of the K=K U=U program, establishing the Consumer Advisory Boards under HIV.
Great. Okay. Thank you. Leave that on there and then unshare your screen.
Sorry. I'm having a little trouble hearing you guys there.
So Asia, can you try
Can you see my presentation?
unshare your screen?
Okay.
Great. Okay. Now we go one by one. Sean, can you share your screen for your PowerPoint presentation?
Sorry?
So what we found this morning was it's easier for the presenters to share their screen. So if you can put out your presentation already to be shared. So what I like to see is to check whether it's all displaying properly.
I'm hearing a lot of feedback.
Me too.
I can hear you all clearly. No feedback. All good on my side.
So Billy and Raymond, can you make sure you have your slides open so then we can go and check whether that is displaying properly?
Yeah, can you see mine?
I think the issue is if you don't have headphones, you're getting the feedback from your computer. From your computer.
My slides are working properly.
So Sean, can you try to share your screen? Is that working? Oh, you haven't shared your presentation yet, Sean.
Who are you referring to now? Midnight?
I'm referring to Sean from Taiwan. Can you please share your screen for your PowerPoint presentation? We want to see whether it's working. Oh, great. Thank you, Sean. It's working well. Great. Can you unshare that? And now let's see whether Raymond, whether you can share your screen.
Who, me now?
Yes, Raymond from Malaysia.
Yes, Raymond from Malaysia.
Okay, hang on. Can you see my screen now? Can you see my screen?
เขาแชร์สกรีนหรือยังครับ
Yes.
Nope, not yet.
Nope, not yet.
Why you're not seeing my screen? Share screen. Share.
มันมาหรือยังครับ Nope, you haven't shared yet.
Nope, haven't shared yet.
Share screen. Share. No, can you hear me? Can you see me now?
Nope.
Nope.
Oh dear. Let me see.
Midnight.
Midnight.
I believe there's some feedback coming from
feedback
you.
coming from you.
I think
I think
we hear a lot of
we
beeps,
hear a lot of beeps,
and I hear
and
my
I
own voice.
hear
right
my
now.
own voice right now.
And you all are probably
And
hearing
you all
my
are
voice
probably
twice.
hearing my voice twice.
Thanks. We'll just kind of try to check
Thanks.
about
We
the
just kind of try
echo.
to check about the echo.
Okay, thank you so much.
Okay, thank you so much.
Okay, can you see me now? Can you see my screen?
Okay, hold on. I think
Okay,
it's
can you see
here.
my
Okay, hold
screen
on, I think yeah.
Yes, midnight?
Yay. Oh no. Yes, that's right.
Yes. Oh no. Yes.
Yes. Okay, cool.
Oh, is that the right one, Raymond? The one you
Oh,
should
is
be
that the right
sharing is
one,
for
Raymond?
you equals you, but you're displaying something on CRM.
Yeah, this is the one.
Okay,
Yes.
great. Okay, yep. Okay, then let's try Billy. Can you share your screen?
Share your screen.
So Raymond, unshare your screen first, and then Billy can share his screen. Hi, Billy. Are you able to share your screen? Oh, Billy is gone. Come back.
Yes, hi, sorry, that did not work. Let me share mine. Can you share my window? Can you see my window?
Sawadee krap. Good afternoon from Bangkok, Thailand, and welcome to the third session of No Time for Excuses, You Equals You in Asia Pacific. My name is Midnight. I am the Executive Director of RRRAP Con, and a warm welcome to this session, and thank you so much for tuning in. The RRRAP Community Conference, as we know as RRRAP Con 2020, aims to provide a regional platform for key populations and LGBTQI community to discuss and share important innovations, updates, and lessons learned on HIV and human rights work in Asia Pacific. As we are operating under COVID-19 era, better coordination is needed amongst the community. The RRRAP Con is also aiming to enable community partners to effectively engage with national programs, as well as scaling up the roles that they play in the advocacy, design, implementation, and monitoring. So we have a really exciting session this afternoon, learning from the U equals U messages that are happening in Asia Pacific region. What we would like to be able to inform you by this afternoon is to get an understanding of what's happening around U equals U in Asia region, examples of U equals U campaigns in our region, and the roles that different sectors play in the U equals U efforts in our region, challenges in rolling this out, and key lessons learned from what has been already implemented. And without further ado, I'd like to introduce Bruce from the Prevention Access Campaign, who's been AppCom's partner to ensure that we are rolling out the U equals U messages across the region.
I am very honored to introduce one of the leaders behind the K equals K program in Vietnam, the first national U equals U program in the world, which I was so honored to be able to visit the summer before last. Ms. Asia Nguyen, MA, who is a health systems advisor for the DGHT US CDC Vietnam programs since 2010 and supports PEPFAR's Vietnam's health systems programs and activities. She supported the transition of CDC-supported Vietnam HIV programs to social health insurance and assisted in the scale-up of routine viral load testing in the country. Recent initiatives include the design and implementation of the K=K, U=U program, establishing the consumer advisory boards under HIV stigma elimination program, and scaling up friendly service and community monitoring models. Prior to joining the CDC Vietnam team in 2010, she worked at UNAIDS in Hanoi as coordination program officer, and previous positions were at PAC and the Population Council, also in Vietnam. She was the chair of the MSM Technical Working Group and worked in prevention and policy support to PEPFAR grantees with a focus on capacity building. Over to you, Asia. I'm happy to introduce
Thank you,
Chi
Bruce.
Chang.
I'm so happy.
You're on, Asia.
To see you all, especially you, Bruce. I'm going to share my screen, and so can you let me know? Yes. Can you let me know if you don't see my screen? Is that presentation coming up? Do you see it?
Yes.
Got it?
Yeah.
Okay.
Thank you.
I'm going to present to you thank you. Can you hear me?
Yes, loud and clear.
Okay. I'm going to present to you very briefly an abstract that was provided at the International AIDS Society. And I'm doing this on behalf of all of our partners in Vietnam who've worked on the K=K program. And that would include the VAC, the Vietnam Network of People Living with HIV, leading social organization Lighthouse, some other academic partners, and implementing partners. Really excited to show you what we've done in Vietnam. So I just wanted to highlight that the background to all of this is that Vietnam has extraordinary viral suppression rates. We documented 95% at the country level last September, and we're right around 98% now. And I think this has been a real testament to how successful our treatment program has been in Vietnam. We really saw K=K not just for treatment and for stigma priorities, but also given the context of the key populations concentrated epidemic among MSM mainly. We really saw the idea, the science around K=K being a powerful driver for the cascade in general. So for case finding, for knowing your HIV status, for PrEP, and all those other pieces. We had all a program approach. It's not just one sector that's contributing to this amazing movement here. It's government, community, the academic institutions, the international organizations, the multilateral organizations. And I'll get into a bit of detail on that in the presentation to follow. So when the science was really starting to firm up in 2017, the government of Vietnam really quickly moved to embrace and endorse these findings because, as you've heard, they had a successful HIV treatment program and they were seeing extraordinary viral suppression rates. And we had rolled out routine viral load testing, and within the space of 18 months, we had increased our coverage to 10%. So when they heard the K=K message, they saw that it could celebrate their treatment program and also be used to facilitate entry into the HIV cascade. So they quickly endorsed K=K in a press conference. We call it K=K in Vietnam, by the way. They quickly endorsed it with a press conference, and they actually changed within about a month of learning about the science. They documented and changed the treatment guidelines to document viral suppression at below 200. So they're basically marking being undetectable as treatment success. Also, Vietnam Network People Living with HIV was one of the first advocates of the K=K message in Vietnam. They quickly worked with preventionaccess.org and with Bruce to translate the consensus statement into Vietnamese. They also came back to us and said, you know, this is a powerful message for stigma, but it's also a powerful message to get people into for 90-90-95. So let's focus on MSM. Let's focus on key populations, especially perhaps HIV negative MSM or MSM who don't know their HIV status, because we think this is a powerful way to get them into the doors. And so we worked with them quickly to establish a small grants program, getting the message out through different community-based organizations, through their networks. And we learned through the community that different networks had different preferences for how they like to receive information. So people living with HIV and people who inject drugs prefer face-to-face forum. They prefer meeting in person and dialoguing it. But young MSM and LGBTIQ, they prefer social media, and Facebook was their platform of choice. So we tailored and we supported the CBOs to get these messages out in the way that made the most sense for their particular network. We also quickly moved to develop 2 initial campaigns that were just focused on KP and especially young MSM, given the epidemic here and what was driving the epidemic in urban areas. We also we selected Hanoi and Ho Chi Minh City as our first 2 cities to do it in because we recognized them as the cultural centers and intellectual centers in Vietnam. And if they adapted and uptook it quickly, then we could spread it to the rest of the country. And you can see the materials here are quite simple, just getting the science out, but also actually trying to celebrate the liberation of the K=K message, that you could actually enjoy sex and have a liberated approach to life, even if you're living with HIV because you have K=K, right? A lot of the concerns we got initially from health providers about the U=U science was how did it apply? There were questions about STIs, condom use, pregnancy. So we quickly worked with the community and health providers to develop key informational materials that they could show on a phone, on a tablet, or on posters in the clinics that could quickly break down the science. And this is what you see here. And this was part of our metropolitan campaigns in the 2 cities. We recognize that healthcare providers are probably a very trusted source of information for a lot of those that go in for services or counseling. And so we really identified centers of excellence. We looked to some of our key university partners who are scaling up initiatives, reaching key populations. And we worked with some flagship sites that were documenting very friendly services, extremely high treatment outcomes. And we looked to them to be centers of excellence and to adopt K=K. And so we had identified these champions here, these healthcare providers, and to get them to work with other sites and other healthcare providers to getting the message out. That was about a year. And so we're going into 2019 now. And based on the success of those 2 metropolitan campaigns, and the science was still coming out with Partner 2, the government, again, really embraced it and actually was one of the first countries, I believe, to institutionalize the U=U finding within policy. And they issued dissemination guidelines to all provinces and healthcare facilities on how they should be talking about U=U with their clients and with their communities. And you can see that here. And this was laying the groundwork for our national campaign at the end of last year. We went back to this community-based organizations. We went back to the healthcare providers. We went back to clients and we asked them, you know the science now. What do you think we need to address? And they said, let's talk about public perceptions of HIV. In Vietnam, due to social evils campaigns, HIV was a death sentence. As you can see on the left here, these are the propaganda posters from when HIV case was first detected in Vietnam. It says, drugs and AIDS, just one time and you'll die. That was the public perception around HIV in Vietnam, and it was really affecting people getting in the doors. It was really affecting people wanting to know their status and wanting to enroll in treatment. And we came up with a campaign, HIV+. So HIV+ life, music, passions, dreams. And to the right is a recreation, a revisionist perception, of course, of HIV. It's a celebration of K=K. It's a celebration. It's a transformative message. And so now it's HIV plus your future. And these are some images from our campaign. So HIV in all those different ways that you could live your life with U=U. We ran about 1 month of social media ads. And we worked with Facebook to develop the key materials, and we launched them on Facebook social media. And within the space of 2 weeks, we had over 8 million viewers of our ads. That's about the population of Ho Chi Minh City, or about 10% of all Facebook users. Collectively, they viewed the ads and the videos and all of the assets about 32.5 million times in that 4 weeks. There were 6.2 million actions, likes, shares, comments, engagement, likes, shares, comments, are passing it forward and that other people had viewed. And the website got about 75,000 people coming to it. We didn't invest very much money in this. It was something like $16,000. And Facebook gave us an additional amount of money because they saw it was such a powerful campaign. And so Facebook asked if they could run additional time with the campaign and give us more analytics. And so what they found was the ads were very memorable and that people were more likely to agree with the statement, HIV is untransmittable with effective treatment. And that was higher than the Asia Pacific norm for all their campaigns. The HIV ads were also, the Cake was K ads were also considered more believable than what the people who hadn't seen it. And it was 20 times more than the average Asia Pacific norm for an average digital campaign. We also reached millions across YouTube with our YouTube videos. We made sure also we bought some ad times with Google so that if you looked up Cake was K or HID or HIV treatment, Cake was K would show up first in your search. We placed key ads and photos. The slogan in key routes in Hanoi and Ho Chi Minh City with an average of 5.6 million viewers a month for the 2 months that they were up. I just wanted to close that campaign by saying that actually it became such a common brand, Cake was K brand, that it showed up as a question on a very popular quiz show about Cake was K. So how are we judging or knowing that our campaign is effective or reaching the people we want to reach? As you saw, one way we do that is by looking at the campaign reach. And so we were lucky to have the analytics from that and to ask additional questions among our community with focus group discussions. We also trained 15,000 workers, healthcare workers during that campaign. And we have HIV knowledge tests, Cake was K knowledge tests. We also looked at viral load literacy as a marker of whether or not the Cake was K message was actually taking hold. And we found that although people knew about Cake was K, it wasn't being linked to the counseling they were getting around the correct times they should be receiving viral load testing, what their viral load test results meant. So we saw it was still low. And so we're thinking and exploring even further about how healthcare workers talk about Cake was K and what is further needed to help them. And actually, the model has been globally recognized. And we're pleased to say that our infographic video was actually shown to the Zambian president by the health minister, and he endorsed You Was You after seeing our video. So we have a comprehensive model here in Vietnam. I've just given you a very brief overview. It's much more complex and has a lot more depth than I'm sharing with you here. But these are the critical elements that make up our movement here for this all of program, all of society approach. And that we do really need all those sectors working together. You need the government endorsement and leadership. You need the community to advocate and demand that the You Was You and the science be shared. We needed to tailor those messages to specific populations and to specific locations. We also needed to ask the community to innovate on how they could embrace and take the science and bring it to their networks. And they knew best what components of that message needed. And then also, how can we really change healthcare perspectives? And we're not just wanting to focus here on HIV health service providers, but we want to talk about all doctors at least knowing You Was You, so that if they meet a patient who's a KP, or if they meet a client who's living with HIV, they can share this message if that's the one thing that they know about HIV. And of course, to move quickly and decisively and to have those public campaigns. So what's up next for us? We're going to evolve into an ARVs for prevention framework, the idea of status neutral. We have scaled up Cake was K really successfully. We're scaling up PrEP. And we see marrying those to a broader message about ARVs for prevention and the idea that HIV status doesn't matter at all. So we want to actually envision a world and transform the way we're implementing services and talking about HIV into a place where HIV positive people can't transmit and HIV negative people can't acquire HIV. And I just want to close with a very lovely, I think very powerful statement by the head of our network of Vietnam people living with HIV in the South. And he said to us, once we got the Cake was K message out, you know, when people were first diagnosed with HIV, they would come to us and ask us, how soon will I die? But now they ask, how soon till I am undetectable? And this, for me, just really encapsulates the success of our program. And thank you. I will end there. I'll give you a lot of information, but I was really happy to share this with you.
I'm happy to introduce Si Chang Sean Du, who joined Taiwan Tongji, the LGBTQ plus Hotline Association in 2002 as a volunteer, and has been since actively involved in the work on gender education and HIV prevention. In 2011, he became the Director of Policy Advocacy of Hotline. His work includes gay men's sexual health and international affairs. He is also a board member of Persons with HIV/AIDS Rights Advocacy Association of Taiwan and a board member of Taiwan Equality Campaign, formerly Marriage Equality Coalition Taiwan. Sean?
Sean, Bruce has just introduced you, so if you can share your screen and then go through your presentation. I apologize for that technical issue.
I'm happy to introduce Raymond Tai.
Yeah, present ได้ครับ แชร์แล้วเรียงครับสกรีนครับ Sean, can you just share your presentation? Sean, can you turn on your mic as well? I cannot hear you. Sean, can you speak? Can you talk? We cannot hear you at all. Hello, Sean. Can you try speaking, Sean?นะครับเขาไม่ได้ยินเขาไม่ได้พูดอะไรเลยครับ Sean, can you turn on your mic? We cannot hear you at all. Can you unmute yourself? Sean, can you hear me? Can you unmute yourself?
Hello?
Oh, I can hear you. Yes, great. Nice. Can you try sharing your screen for your presentation, Sean?
Okay.
Thank you.
So I will be the next presenter, right?
That's right, yes.
Okay. Oh,
Thank you very much, everybody, for being so patient with us. Great, Sean. Your presentation is up, and we're ready.
So hi, everyone. I hope you can hear me clearly. So my name is Sean, and I'm from Taiwan Tongzhenhan Lai Association. So we are the LGBTQ organization in Taiwan. So today I'm gonna share about the U equals U in Taiwan. So the HIV epidemic in Taiwan now, actually the new infection rate has decreased. And I think it's a combination of like different strategies like PrEP and PEP, and also like a rapid treatment and like U equals U, and also like online, like a home testing providing. So, and I want to share about like how has U equals U being promoted in Taiwan. So you can see that actually, I think the treatment power comes from NGOs and like medical professionals and like medical society. So HIV NGOs and medical professionals has promoted U equals U in recent years. For NGOs, we produce articles and infographics, give lectures and share knowledge of U equals U during testing. And NGOs and medical society also try to be creative to have some charity merchandises and posters based on U equals U. And we also share the knowledge through mass media, social media, and get supported from like celebrities. And in 2019 and 2020, NGOs and the Taiwan AIDS societies also formed the Taiwan AIDS March Coalition to share the knowledge of U equals U and get support in Taiwan LGBT Pride and get a lot of feedbacks. And in this year, actually, our Taiwan CDC start to produce leaflets this year. And however, actually, they don't mention U equals U directly. In this leaflet, they use like a wording like when you are undetectable for a certain time, it is almost not likely to transmit HIV to your partner through sex. Their wording is very cautious to prevent opposition and conflicts from like some anti-LGBTQ or anti-HIV groups. And they also ask NGOs and public health workers to mention concepts of U equals U, PrEP and PEP when they give lectures in schools this year. So which I think is good for them to have this policy. And how does the society see U equals U? The Taiwan Lutz Association, Taiwan HIV Story Association, and GSK launched a telephone survey to test Taiwanese people's knowledge of and anxiety about HIV/AIDS this year. The result shows that 51.8% of the participants understand the meaning of U equals U. And also, for those who don't understand U equals U, 45% becomes less afraid of HIV/AIDS after they are given explanation of U equals U, which I think is really powerful. And so how does it affect people living with HIV? So in the 2020 people living with HIV's living conditions survey, so 94% of the participants have heard of U equals U, and 89% think that U equals U has positive impact on their HIV positive identity. 66% think that U equals U helps lower their anxiety when interacting with others. But however, only 45% think that U equals U like really makes the society more friendly, and while 55% of the participants don't agree. Yeah. So, and unfortunately, we don't have data about like how gay and bisexual so far. Also, I want to mention like one particular situation in Taiwan. So in Taiwan, we have the HIV Infection Control and Patient Rights Protection Act. And in this act, the Article 21 actually saying that, so in Taiwan, if people living with HIV don't reveal their HIV status and have safe sex with others, they shall be sentenced for 5 years up to 12 years. It's really heavy. And most of the cases are punished for 1 to 2 years, even when the counterparts don't get infected. The law puts too many responsibilities on people living with HIV and treats HIV/AIDS differently than other transmitted disease. Also, the criteria of unsafe sexual behavior doesn't include the idea of U equals U. It is like outdated. So NGOs, workers with the strategy for litigation on Article 21 related cases. There are several cases that the prosecutors don't appeal and the judges don't punish people living with HIV based on U equals U. So I think that is also a very important progress. But actually, it's a little bit late. Yeah, and also like for NGOs, actually we try hard for years trying to amend the Article 21. And so we will also take U equals U as a strategy to amend the law, at least to amend the criteria of unsafe sexual behavior, so that like most of the cases will not be punished because of this article. So what we have learned from U equals U, actually in Taiwan, U equals U along with other prevention strategies has made HIV incidence decrease in Taiwan since 2018. And U equals U has been adopted more extensively by community organizations and medical professionals in HIV/AIDS field in Taiwan in recent years, because it is such a misunderstanding and stigma. But we also find that there has been discrepancies in awareness and adoption of U equals U on community level. So more research and efforts should be addressed to close the gap. So we also find some challenges. First one is that it is fine for like most NGOs to talk about U equals U when we give lectures to students and medical professionals. But how to use the wording to make people more understand about U equals U, we need some efforts. Like some people still don't think that there is risk when they hear it, like the word like it is almost not likely, or the word like the risk is approximately 0. They think that, oh, it means that there's still like risk, so they are still afraid of getting infected. And we also find that some discussion on gay men's online forums. So some gay men are like hard to believe that U equals U as a scientific knowledge, and they think it's just an excuse from like some people living with HIV who want to have bareback anal sex. I think it shows that how strong the fear to get infected and AIDS-related stigma are to this gay man. And also, because of the HIV stigma, people living with HIV are hard to reveal their HIV status in Taiwan. In an online survey with like 2,500 gay and bisexual men participants done by Hornet and Hart, 79 of the HIV positive participants don't show their HIV status on dating apps. And also we see that we think that it's important to let like more healthcare providers understand and accept U equals U, especially the dentists and their assistants. Like hotline, we work together with another HIV organization, PRAA, to for survey, to do a survey for like dentists, to ask them if they want to treat people living with HIV when they are like undetectable. And we found that actually like more than half of the assistants and dentists still refuse to treat people living with HIV, even when their viral load is undetectable. And finally, how to present U equals U from becoming a standard to judge people living with HIV is also very important. There are many reasons that some people living with HIV don't get treatments or don't reach undetectable. And we are also be very careful that we don't want U equals U become a new standard and to judge like people living with HIV, like who is good or who is bad. So I think those are the challenges that we still need to deal with. So thank you for listening, and I look forward to your questions and feedbacks. So thank you.
I'm happy to introduce Raymond Tai, who is the Acting Chief Operation Officer at PT Foundation, a community-based nonprofit organization working with key affected populations on HIV/AIDS and STI advocacy, prevention, treatment, support, and care work. He has volunteered for PT Foundation for more than 20 years and has been working full-time with PT Foundation since 2007. Among the programs that Raymond oversees are peer outreach groups, HIV treatment adherence programs, counseling and mentor, and a community-led clinic. PT Foundation works with vulnerable populations such as gay men and other men who have sex with men, people living with HIV, children and mothers infected and affected by HIV, refugee outreach, and college students. I'll turn this over to Raymond.
Raymond, you're on. Can you please share your screen and go through your presentation?
Hi, good afternoon, everyone. Can everyone hear me clearly?
Yes, we can hear you.
My name is Raymond. I'm speaking from Kuala Lumpur, Malaysia. I've been asked to share my experiences coming from a CBO in Malaysia on the whole subject of U is equal to U. Some clarifications at the moment are, I think we in Malaysia I'm approaching from the context of a community-based organization, a grassroots organization which has been doing HIV work in Malaysia for more than 30 years. So the structure in Malaysia is that the Ministry of Health Infectious Disease Unit is the one who's driving the agenda in Malaysia, and they work with an umbrella body called the Malaysian AIDS Council, which is formed and represent the other organizations in Malaysia that does HIV/AIDS work, of which PT Foundation is one. So bear with me when I'm presenting this. I'm looking in from a very micro level as PT Foundation, looking at the context. I think to put everyone in context as well in Malaysia, we have a concentrated epidemic in Malaysia, whereby sexual transmission takes up almost 95% of all infections in Malaysia. It didn't used to be like this. It used to be led by drug users. But in the last 10 years, especially in the last 6 years, sexual transmission has overtaken injecting drug use as the #1 mode of infection in Malaysia. And what's as worrying for us in the community is that more than 60% of the sexual transmission cases is due to homosexual and bisexual sex, according to the IPPS studies in Malaysia. So we definitely right at the highest risk category in Malaysia, specifically MSM and transgender in Malaysia. So in that context, I am making this presentation here and sharing my screen. Okay. So I've been asked to very briefly go through the 5 steps, 5 different areas of how we are experiencing it in Malaysia: community understanding, examples of campaigns, the role of different sectors, challenges in rolling out, and key lessons learned. All right. So looking at community understanding of U is equal to U, I think the first thing to note is that it's not one community. There are different segments in the community to look at. So if you are a person living with HIV, your understanding will be a little bit more different from those who are non-PLHIV. And within a non-PLHIV, MSM and transgender will probably have better awareness than the public out there. All right. So if we look at the first box on the left, PLHIV linked to care and support. By this I mean those who are already taking part in a national program. We have a national the government in selected clinics, whereby we encourage as many of the community to go for testing at these selected clinics that are trained and sensitive to community needs. They do the HIV test, and if they're tested positive, they are linked to care and treatment and to the support of an NGO that is connected to that clinic. So that model is running well. There are about 50 over clinics that has this service available throughout Malaysia. I think every state there is at least one clinic. So that's running reasonably well, and where we see there is care and support from NGO, the adherence is a lot better. In Malaysia, when we look at the 90-90-90 targets, we find that our adherence is rather low at about 54%. Whereas in terms of people who are HIV positive and know the status, it's apparently quite high, and people who are adhering to the treatment is quite high. But it is the middle one that is lacking, and I think that's where the government and the NGOs are concentrating a lot of effort on, in searching for these people who are HIV positive and linking them with care and support. So when we look at U is equal to U, because there is outreach workers and case workers directly working with government counselors, doctors, and medical officers, you find that their concept of understanding U is equal to U is very good, and that's probably one factor about why they are adhering to treatment better. But if you're looking on, there are a big segment of PLHIVs who are accessing treatment, but they are not linked to care and support from these NGOs. We don't have any data on that one, but I am particularly concerned because the DHSKP model is not extensively throughout all clinics in Malaysia. It's only in selected ones. And we're going to miss a big segment of these populations. And for those populations, we are a little bit in the dark about how properly they understand U is equal to U. And as a result, whether they are adhering to treatment or not. We are hearing anecdotally that there are many who are falling out of treatment, either due to side effects, due to drug dependency, or due to mental health issues, and that's worrying. So that's a segment that will need a lot more work on. The third box is the PLHIV who are not on treatment. So that is the ones that they could have been tested and screened at blood donation drives or at mandatory tests conducted by employers and all that. But because of the huge stigma and discrimination in Malaysia, many of them, even though they know they're positive, have not got themselves registered with any clinics for treatment. Although treatment is free in Malaysia in government clinics, it is actually very troubling that there is a segment of people out there who, because of the huge internal stigma and discrimination against them, they are not linked to treatment. So for this population, the concept of you is equal to you is probably non-existent. Most of these people fear that upon contracting HIV, that is a question of time before they die, and they're not accessing treatment anyway because of the stigma, right? And there's a big segment of these people who are also injecting drug users, and they could also be meth users, recreational drugs, and they face some significant mental health barriers as a result of their drug dependency and other anxiety, depression issues. So that's another segment that will need a lot more help and a lot more try to get them to understand what the U is equal to U. Yeah. And then within the MSM and transgender community in Malaysia, again, we don't have a lot of published data on this, but from our experience going on the dating apps and everything, we find there's a lot of stigma and discrimination against people living with HIV. I think in dating sites, you get comments like, I only go with people who are negative, positive people don't bother replying me. It's very stigmatizing, and you get a lot of small talk happening out there, whereby people who are HIV positive are being disclosed to their friends, and everybody is talking about them. And even at our organization, we get calls from people who are saying that, oh, do you know so and so is HIV positive, and they're still going to the saunas, they're still sleeping around. Can PT Foundation do anything about it? So, and they don't really understand that HIV positive people who are on treatment for a long time is undetectable and untransmittable. So, long and short, I think we have a lot of work to do in Malaysia to get even the community to understand this whole concept. Examples of campaigns in Malaysia, unfortunately, again, I think in Malaysia, as far as I'm aware, there is no national campaign around HIV/AIDS for a very long time, let alone U is equal to U. Yeah? Because it is a very concentrated epidemic. It is not talked about in government mainstream media, and among NGOs, the only NGO that has resources to mount something like that will be Malaysian AIDS Council, which is the umbrella body. But as far as we can see, there's really nothing happening in there, partly because also funding to do something like that is non-existent. Yeah. So under the DHSKP program, the Differentiated Health Service Delivery Program that I mentioned just now, there is some effort going around to educate. There have been workshops conducted for the staff, outreach workers and case workers in this program, and they know what it is so that they are able to educate the clients on this. But that's a very small segment, and there is no coordinated social media campaign on this. At PT Foundation, we tried to do that. We had some limited funding from TikChat, from a drug company before to do that. But those funding is only for 1 year and it's not sustainable. So after 1 year, it's gone as well. So unfortunately, we don't really have a lot of communication campaigns going around. We were thinking of doing that with the bars and clubs that we go to outreach with in Malaysia, including most of these bars and clubs are close to the lockdown under the COVID-19 pandemic. Let's look at the different roles of different sectors in Malaysia Malaysia, like I mentioned, in Malaysia, the HIV/AIDS agenda is spearheaded by the Ministry of Health under the Infectious Disease Unit. Unfortunately, they are very much on program. There is another unit in the Ministry of Health that talk about communications, but the campaigns are mostly on NCDs, and they don't do specific campaigns around HIV and AIDS. We have a pretty good structure in Malaysia in the sense that we have a good collaboration between the Ministry of Health and the Malaysian AIDS Council. So there's a lot of engagement there. Unfortunately, though, again, the Malaysian AIDS Council is also very program driven, and a lot of the services are about getting people to get tested, bringing them to the clinics. But I personally think that they should be doing a lot more in terms of public awareness, in terms of targeted awareness towards key populations. And then you come down to the CBOs. So CBOs like us, we have the passion and the drive to do a lot of things, but we often lack the skills and the resources to launch social media campaigns, let alone national campaigns. But we work closely with universities and colleges to do a lot of awareness programs. And when we get invited, we do talk about the new developments like PrEP, and self-testing, as well as U is equal to U, two populations out there, but they are all very small and not mainstream, right? So in the mainstream media would actually be able to do a great job if they can do that, but I think those of you familiar in Malaysia know that we are living in a very conservative, traditional Islamic society and there is actually a broadcasting regulation that says that if you're going to promote anything with regards to LGBT populations, you cannot do that unless in the story or in the campaign you see the LGBT person either die, repent, punish. That's the only thing that's allowed. So let alone an affirmative program around U is equal to U. Social media is probably the only space that we can do a lot more creative stuff, and we do small campaigns here and there. But by and large, we don't have money to really buy social media space, or produce like great videos. We have a lot of creativity, but limited funding to really produce videos. So it's not a very, that's where we should be, but we're not doing enough things there. So moving on, what would the challenges be in Malaysia? I think huge challenges. Foremost, I touched about it already just now, is the disenabling environment. So we know in Malaysia that homosexuality, the act of homosexuality is illegal under Penal Code 377. But if you're a Muslim, you cannot even be identified as gay because there are regulations around. If you're a Muslim, you're actually insulting the religion by disclosing your sexuality, your gender. So it's from a legal perspective, from a cultural perspective, it's very bad out there. I think there's huge stigma, starting off from schools and colleges to families, especially in suburban families. So unless we can sort of like begin to turn around that disenabling environment, a lot of what we want to do, we won't be able to do through the government. It will have to be done by NGOs. So the Ministry of Health is generally doing a good job in terms of health programs. We get free treatments for HIV, and in the selected clinics that we go to, the doctors work very well with us. Most of our clients do not encounter stigma there, but overall, in all the other non-HIV, non-ID clinics of government hospitals and clinics, it's quite different out there. There's still a lot of stigma happening. Malaysian AIDS Council has a big role to play, but unfortunately, they see their role very small in terms of rolling out the DHSKP program and implementing it. I don't see enough efforts going in terms of launching big communication campaigns, whether it's around PrEP or around U is equal to U. So again, it's left to CBOs like us to do what we need to do, but with limited resources and skills, we're working, we're moving, you're using a pin to move mountains. Right. So lastly, what key lessons to learn about learn from Malaysia? Unfortunately, when I look at what Vietnam is doing, what Taiwan is doing, I think we can learn a lot more from them. Uh, I think the fact that we don't get international funding also means that we don't get a lot of technical resources. We don't have PEPFAR, UN, AIDS, all this big technical support in Malaysia. So I think the technical facilities we have is very limited. So there is, we need national leadership in this thing here, which is not forthcoming, either from the government side or from the umbrella body. We need huge investments in social marketing. I think a lot of what we do in HIV/AIDS industry in Malaysia is around programs and services to key populations, but we don't really do a lot of demand services, generating demand, social marketing in principle. We is very lacking in here. Also because of the restrictions in terms of what we can do in the mainstream media. We definitely need to develop more skills and resources, even among NGOs, so that we can understand and be be the trainers better. And of course, most importantly, I think we need to mobilize more champion activists, uh, which is a challenge as well because very few PLHIV, especially from key populations like MSM, are willing to be public spokespeople around HIV and AIDS because of the huge stigma and the law against them. So uh, sorry, these are all quite negative things, but I think what I'm trying to say is here is that if countries are looking at doing campaigns, you do need all these big pillars in place before they can really launch a good campaign. I think I'll end there. Thank you.
I'm pleased to introduce Billy Chu Sangsub, who works with Solidarity for LGBTQ Human Rights of Korea, which is an organization established in 1997 to uplift the voices of sexual and gender minorities in Korea. Since then, the organization has been building solidarity with social minorities in Korea. Billy Chu Sangsub, take it away.
Hi, Billy, you're on. So can you please share your screen for your presentation? Thank you.
All right. Can everybody hear me?
Yes, all clear.
Hi, so my name is Billy Chu. I will be speaking about U equals campaign, U equals U campaign in South Korea. I am a member of Solidarity for LGBTQ Human Rights of Korea, which is a LGBT-focused grassroots movement in Korea, and I'm just a lay member. So this is how the presentation is going to flow. I'm just going to barely mention about what HIV activism is in Korea and the prevention efforts in Korea, and then how the Korean HIV activism has met U equals U and how it has endorsed it. And then we want to talk about examples of U equals U campaign in Korea, and then challenges of rolling it out, and then lessons learned. So I'm giving a lot of text here. Hopefully you can all just follow along with me. So HIV activism in Korea has been centered around supporting and uplifting the voices of PL HIV in Korea. So it has very much been about raising the human rights issues relating to people living with HIV in Korea. So it has been talking a little bit about prevention, but a lot of the prevention efforts that activists has been talking about for the past 20 years has been about reducing stigma around being with HIV in Korea, because that has been such a huge issue and that has been deterring people from accepting their HIV status, which also does lead to the greater prevention efforts because people need to come out and get tested, right? Um, and then on the other hand, prevention efforts in Korea, which is mostly led by the government, has been focused on managing people living with HIV so they would not be infecting others. Like they would be tracing them down to see where they are, having monthly check-ins about 20 years ago. And then also it has been a lot about giving out condoms. So there is a government-funded HIV testing center that caters mostly to sexual minority men, which is somewhat of a collaborative effort between queer community and the government. However, their stances on prevention has mostly been about giving out condoms and kind of scaring people away from like having unsafe sex or whatever they think unsafe sex is. So moving on, um, Korean HIV activism was the first sector in the HIV cascade of care and also the whole grander society dealing with HIV in Korea to meet and endorse the U equals U movement. So it was first introduced in March of 2018 when I actually translated the consensus, a statement for a team seminar at my organization. And since then, the Youth PL HIV Community of Korea R, which is actually the grassroots movement that the APCOM contacted to give a presentation on and then got forwarded to me. So they actually became a community partner of the Global U equals U campaign as of last year, I believe, and that made the one and only organization in Korea to endorse publicly of the U equals U campaign. But so U equals U quickly became one of the key messages of the activism for three main ways in which that we have been equals U message. The first is that it is messaging for community outreach that reduces the stigma of HIV. We used to say that HIV is a chronic disease and you can manage it if you are on this treatment for a long time. But now that with the findings from U equals U and the partner study, we are talking about how people with HIV, as long as they are on treatment continuously and living without stigma, it doesn't really affect their life expectancy. So we are using those messages to do community outreach. And then it also provides an alternative to condom-led prevention effort to talk about how treating people with HIV is the key to prevention, actually, right? And that's something that the activists on the ground has been focusing and talking about this whole time. And now it's coming to fruition with the scientific backgrounds from the U equals U. And finally, and this is something very similar with Taiwan, is that Korea still criminalizes people living with HIV for HIV transmission. For us, it's Article 19. Taiwan is Article 21. And it's under the AIDS Prevention Act. And we have been using, the activists have been using the U equals U to get HIV transmission decriminalized, so that there is less of a legal stigma against it as well. So here are some examples of U equals U campaign in Korea. So we do outreach at queer festivals and we are giving out, we are engaging people using these kind of picture campaigns to engage people to talk about HIV on social media, where a lot of people do engage with one another. And then we're giving out little flyers that has information on U equals U. However, we have to say that this is very much of a grassroots movement, and amount we can produce these kind of images and flyers are very much limited to our own resources, which is basically based on funding from each other. And then we're going off to the on and offline campaigns. The first one that I want to talk about is this one. It reads, "Can I come inside?" It's a very provocative message, right? It was an image that would lead them to go to a page about You Equals You campaign, just to get, it's clickbaity, but it still gets the message out and also kind of plays with how people engage, especially MSM people in Korea, engage with one another sexually, and how HIV becomes a problem in that area of life. And then secondly, this was also the title of a forum session on MSM sexuality that really centered about the idea of we needing to talk about HIV status and being able to accept whatever that comes to you when you do talk about it and when you choose not to talk about it. So we are using these You Equals You messages to really broaden our approaches to people, to get people to be more accepting of being able to talk about HIV in a non-stigmatizing manner. And then this is a hard news that we disseminated on social media to talk about how we need to repeal Article 19 of AIDS Prevention Act. And we were using the messages from You Equals You that, hey, if you're undetectable, then you are untransmittable, which means if you are having sex with another person and currently you are criminalized if it's known, if it gets known. But if you don't have any chances of actually transmitting the virus to some other person, then why should it be a law against it? So we're talking about liberating sexualities here with the You Equals You message on the legal side of things. And then there are challenges. So I've been highlighting mostly what the government, what the grassroots movement activists are doing, mostly because that's all there is about You Equals You campaign in Korea. There is just lack of proactive stance from the government. So I was very much envying what Vietnamese government is doing. But as of July of 2020, the Korean CDC's webpage, Center for Disease Control and Prevention, has one paragraph on You Equals You, and that's all you see. Like what I have here is all there is of the information on You Equals You, and basically it just lists us out, and we're glad that it's there now, but it wasn't there about 2 years ago or even a year ago, so it has been recently updated. There are programs funded by the government that has been using the terminology, but they are not doing it as proactively as the activists, despite the funding. And there are no nationwide campaigns for You Equals You up until now. There are some campaigns about reducing stigma against HIV infection, but it still very much dates back to the same idea of like, oh, let's not discriminate them. It doesn't go beyond that kind of rhetoric. The second challenge in rolling out You Equals You is that it's lost in translation. I think one of the biggest merits of You Equals You is that it's so easy to say undetectable equals untransmittable, which are two made-up words, right, in English, which still does have that information and gives it out very concisely. However, whenever we have to talk about it in Korean, the words become very scientific, and we have to unpack it with people. So there's a lot of work to do in campaigning and using the right words to engage people and have them understand what we're talking about on a scientific note. And then there is HIV stigma that still plagues the Korean queer society. We were just talking about how we did a campaign on Can I Come Inside? And that had a huge backlash on online and offline for its how provocative it is, despite it be HIV still being much of an MSM issue in Korea. So there is still a lot of hesitancy of how to talk about HIV and PLHIV who are living among us in Korea. So there are 3 lessons learned. So first of all, we need to challenge the HIV stigma simultaneously or even before rolling out the U equals U campaign for the synergistic effect. U equals U campaign and its message, it's great. And I guess there is still the part of challenging the HIV stigma in that campaign as well. But both messages of needing to challenge the HIV stigma and undetectable means untransmittable needs to go out together for its synergistic effect. And then this is something that we have learned from all the groundwork in Korea is that prevention efforts need to be centered around experiences of people living with HIV. They were the ones who actually lived through and were subjected to a lot of the legal system that deters people living with HIV to live their fullest life. And also, they were also the part of the prevention before they got infected and now living with HIV. So we need to be listening to how they are responding to the campaigns to see if they're really in line with reducing HIV stigma in Korea. And then lastly, our activism need to also speak for those who are not at undetectable levels for whatever reason they may be. So it was a very quick, I think I just breezed through it. I hope it was all right. And thank you for listening to my conversation on this. My contact information is my personal one, but if you have any questions or if you need any resources from Korea, I'm willing to connect you to the organizations that will be able to provide those resources. Thank you so much.
I'm very happy to introduce Kota Iwahashi, who's the president of ACTA, which is running a community center in Japanese gay town, Shinjuku 2 Chome, which I was very happy to have the opportunity to visit ACTA and see the incredible work. ACTA's mission is to raise awareness, promote HIV prevention, targeting MSM, and reducing stigma against people living with HIV and AIDS in Japan. He is a medical sociologist and public health researcher, has played the central role in Japanese Ministry of Health research groups exploring the prevention of HIV and STIs among MSM, and especially in testing promotion. Over to you, Kota.
Hello, everyone. My name is Kota Iwahashi, the representative of the Community Center ACTA in Shinjuku 2 Chome, Tokyo, Japan. Today, I would like to give you a brief overview of the current situation of U equals U in Japan and the U equals U campaign that is planned in Tokyo. First of all, I'm sorry that I cannot join today in real time. I was hoping to learn about the experiences of other countries and regions and exchange ideas, but due to scheduling conflicts, I'm speaking in a recording this time. Okay, so now about U equals U in Japan so far. Various initiatives have been conducted. In 2018, U equals U campaign was conducted by several NPOs such as Praise Tokyo, an organization that mainly supports HIV positive people, and March Osaka, which mainly targets MSM to raise HIV and STI prevention awareness. And the U equals U Japan project team was formed with researchers, NPOs, and healthcare professionals. And in 2019, the Japan AIDS Research Society officially declared to support for the U equals U campaign. This year, in January, the U equals U Japan project team invited Bruce Richmond from US, Simon Collins from UK, and Dr. Stefan Koo from Taiwan to Japan to hold study sessions and exchange ideas with medical professionals, researchers, government officials, NPOs, and the community. And in March, it was clearly stated that HIV care providers should communicate with patients about the fact of U equals U in the Japanese HIV treatment guidelines, which many HIV care providers follow. So now we'd like to make a question about how much awareness about U equals U has been widespread in Japan. According to a survey conducted by the Japanese Cabinet Office in 2018, the general population's knowledge about U equals U was very low, about 30%. On the other hand, how about within the MSM population? The latest online survey showed that more than 60% in the MSM population knew it. However, it is also true that there are still issues regarding U equals U in Japan. First, because of Japanese social welfare system, same-day out and treat early are impossible yet. Patients with HIV in Japan have to rely on the system to access treatment and care. Thus, it takes time to be undetectable. Second, the human rights of people living with HIV in the U equals U campaign are not fully understood by even healthcare providers. In the treatment of HIV positive people, some medical institutions other than specialized HIV treatment centers, such as some dentists, said, "Please come to see us when the virus is undetectable." HIV always becomes the focus of medical institutions, while more infectious diseases such as syphilis and hepatitis are the issues. And third, while U equals U known literally within the gay community, U equals U as the issue of human rights and promotion of comprehensive sexual health are not well understood. Some mistakenly interpret that U equals U means it's okay to have sex without condoms. In response to these issues, we, ACTA, planned to launch a U equals U campaign for the Tokyo Rainbow Pride Parade, which was scheduled in this April. In addition, we had a collaboration with HIV support groups and a network of HIV positive people and create the message of the campaign together. Unfortunately, the COVID-19 pandemic has delayed the campaign schedule significantly. However, we plan to launch the campaign at the end of this month for the World AIDS Day. The campaign not only conveys the basic knowledge of U equals U, but also challenges to convey the true message about U equals U in Japan, which I mentioned earlier. Mainly targeting MSM, we use sexy visuals to promote sexual health to the target. We are also preparing this information in multiple languages for foreign MSM living in and visiting Japan. A big issue in Japan right now is how to develop health literacy in the gay community to understand and manage new information about HIV, such as U equals U, and new prevention methods such as PrEP to maintain sexual health. For U equals U, we do want not only to conduct the campaign, but also continue our efforts and dialogue with our community and the general population to promote comprehensive sexual health. Thank you all for your patience. I wish you a very successful symposium. Have a good day.
Thank you so much, Kota, and thank you so much, all the presenters. Thank you for staying on, everybody, in spite of all the technical issues. So now let's try to get all the speakers back on for some discussions. Oh, I can see Asia, I can see Sean, I can see Billy. We're waiting for Raymond. Let's hope he gets on. But like whilst we're waiting, Asia, that was incredible. The other speakers talked about the leadership in Vietnam at the governmental level to be able to do this very nationwide campaigns on K equals K. How did that actually come about? Is it because of the science, or is it really because from the leadership already that then got the science and then thought, okay, we need to really scale this up quickly and then widely?
It's a combination of factors. I can't identify it to one, but yes, there's a lot of innovative leadership here within the Vietnamese government. But also, you had the strong science, and we had the program to back it up, the program results to back it up. And of course, Vietnam is a PEPFAR country, so there's a lot of encouragement, shall we say, of reaching our epidemic control goals. So this message is such a versatile message. The science is so powerful and so transformative that I think it really helped to have not only the leadership of the ministry in this, but also that the community was very strong in embracing this early. And so, yes, there's questions around the applicability and nuancing those messages, but ultimately, I think the leadership signed on here because they could see already they had such a high number of people who were virally unsuppressed or who were undetectable, and undetectable, that it was an easy step to say, yes, we can do, yes, we believe this. So, it also helped, I think, that we had a lot of, we could bring in science from different partners. So we had the academic institutions talking about this. We had international champions, global champions. It was just a confluence of a lot of different factors, not just one.
Thank you. And I'm Sean. I guess a few people are very surprised in Taiwan about criminalization of HIV transmission when there is already the marriage equality right in Taiwan. In terms of the U equals U campaign that you've been doing, have you been able to kind of get any more people living with HIV actually coming out and really support the U equals U campaign and say, because of this campaign, I really feel I want to come out? Or has it been a challenge because of the criminalization of the HIV transmission that seems that don't make people want to then speak and then come out about it?
I must say that I think for several like young HIV positive activists, yeah, there are some people just coming out to share their stories, and we also have some who are like social celebrities. So, but I must say that not many. Yeah, we still need more. Yeah, as I know that I know many like HIV positive people and activists, and some of them just don't want to reveal their real status to others because they still need to suffer from a lot of burdens. So yeah, so that's what I think is need to be achieved in the future.
Thank you for that. Raymond, you talked about, from say, Vietnam being a PEPFAR country and have global funding, whereas in Malaysia is a upper middle income country without access to those kind of funding, particularly for the community organizations. So my question to you, Raymond, from what you have heard from different countries here, are there anything that that would help in terms of supporting some of the maybe access to some of the technical support or some funding that others can support you on that?
Yes, I think we do get on and off some funding, not so much us as in our organization, but a lot of it is channeled through Malaysia Nets Council. For example, there is the Global Fund at the moment, and there are two different grants. There is the transitioning grant for programming, and there is a multi-country grant which Malaysia is part of. But the funding that is coming to Malaysia is very selective. It's mostly about capacity building and transitioning, and it's mostly things that are being done at the umbrella body level by Malaysian AIDS Council. So I understand there is currently a funding to investigate or do a pilot program around self-testing as well as around chemsex and on PrEP. So those are meaningful things, but they're all very small and very selective, and mostly on pilot research study kind of programs. Even in the current Global Fund program for Malaysia, the one that is the DHSKP, the Differentiated HIV Services Program, there is no funding allocated for NGOs to do social media campaigns. So that's a bit restrictive. A lot of it is about on-ground outreach and face-to-face outreach and testing facilities. So
and Raymond,
that's why when I go to Bangkok, I'm always so inspired by what's happening there with funders like PEPFAR and UNAIDS, because they just bring in funding but bring in technical support, and I think that's what we really welcome, and we hope if funders are listening that they will not miss Malaysia out in these things. Thanks.
Thanks for that, Raymond. Now let's move on to Billy.
Thanks.
Thank you for stepping in, for speaking and giving the voice of South Korea into this space, because we don't normally get to hear really from what's happening in South Korea. And of course, you know, as another kind of like Asian country that is very developed, we're also kind of like, kind of surprised in terms of the HIV transmission being criminalized as well, and the levels of stigma, discrimination, particularly for the queer communities there. And then in terms of your campaigns that you've been able to kind of get together from the support from the communities themselves, how has that been arranged? And then to do these kind of campaigns online and in hotspots, are the communities really then in like businesses, or are there like students? Can you just give a little bit more of an understanding of how you've been able to mobilize resources from the communities themselves to do a campaign?
I see. So we have a network of HIV activists in Korea, and we come from, so basically it's activists from a lot of different social, no, it's not social, sexual minority groups and organizations in Korea come together to form a network to talk about HIV-related issues in their communities. And they like these organizations will also have partnerships in the community themselves, so we can spread the message out very quickly. And what we sometimes do around World AIDS Day, which is coming up very soon, is that we would go around and put up posters about HIV stigma, like destigmatizing, like things that celebrate people living with HIV, posters that talk about how being HIV positive is a positive aspect of their lives, and how they also have a history behind them that they really need to see that should not be masked by HIV. So we do those kind of posters and we put them up in gay bars, essentially. And that is based on over 20 years of collaboration that has built over time between communities and from within the community to talk about HIV-related issues. And I think that is one of the very biggest momentum that is existing in Korea right now, is that the queer community and the grassroots political movement is around the queer identity is very much thriving, despite the government not really caring about us in the
that's great.
For the most part, right?
And like,
yeah, I think that is a big part of it.
No, that's totally like a community leadership and the networks getting together and, you know, solving issues where they know that the government is not, you know, looking after the needs. But what I do see from the 4 countries that has presented the, you know, the posters, that the campaigns that they're doing, the sex positive, you know, the about the stigmatization. It's just so wonderful to see those. Asia, in terms of your campaigns, there's so many different visuals that you're doing, and it seems to be very more broad-based. Are those deliberate? Because I know that's going on like everywhere, social media and also on the streets as well. So what is the process for you to think about who will you target and where these ads and placements will go? Thank you.
Thank you for your question, Midnight. So we had multiple levels of the campaign, and it's kind of a living thing, it's fluid. But the idea was, who did we really want first to get that message? And so it was our key populations. And so we worked with the community and said, what do you want? So it was a lot of conversations with different community actors, influencers, and partners, and healthcare providers. What do you need to embrace this K=K message? And of course, community, different networks, they have different preferences. So we designed some initially to be provocative. So if you saw in the presentation, some of the very first ones, very sex positive, but also kind of a little bit risque in the Vietnam context. We did that to grab people's attention. And so we did that in more limited ways. We didn't have a whole national campaign. We did that in 2 cities. And so we worked with our community leaders and community-based organizations to blast it out in whatever form they wanted. And we made sure it was visible everywhere. And then as we moved into the national campaign, we did a second round. We showed them, we did surveys, we did community focus group discussions. We worked with an amazing media company to do this. And this media company was actually not a public health media company. It was a commercial media company. So they really understood and tried to understand marketing techniques and what a public, like a general person the public would want versus somebody who's a healthcare provider versus somebody who's an outreach worker versus someone who wants to get in and get tested. And so there are multiple levels to our campaigns. And so the public ones will be the most simple and the most provocative, but then we move into materials that have more information that provides you links for those who needed it. And then I didn't get a chance to show you so much of the work we did with our community partners, but with the grants program, we asked the CBOs to create their own materials. And so if there's ever another presentation, I'll show you all of the stuff that they have done, but they had live streams, they had talk shows, they had photo competitions, logo competitions. And I think we had something like 81 social media posts over the course of a year and about over 900,000 people engaged in it. So I guess my point is not one message will fit everyone. And so to really target it and who do you need on your side first? And then also to allow people the freedom to target and to create materials that they feel would be the most effective. And only those who work within their networks would know what that is.
Thank you, Asia. And let's move to Taiwan. What was the process for the campaign's visuals and discussions that you're having with the communities and also those that are not within the communities, how they responded to those? Sean?
Sorry, can you say it again?
Oh, in terms of the creatives for your campaigns, for the U=U, for your populations, what was the process? So Asia talked about, having discussions with different communities, and then different communities have their own visuals and what to kind of put on to the, I guess, the ads. For the Taiwan Tongji hotline, what was the process and how do you engage with the community and those outside the community for the campaign itself?
Yeah, so so actually in Taiwan, sorry, let me check. So do you want me to share about what's the progress now?
No, talk about the visuals, the ads that you put out about U=U in Taiwan. It's very sex positive. How do you go about doing that? What was your process? What was your thinking? Did you test it out first? So Asia talked about in Vietnam, they go to a media agency to create the ads through discussions. What was it like for your campaign? What did you go through? Yeah.
Okay, I see. Thank you. Sorry. Yeah, so of course, our advertisement or our campaign is always like sex positive because we want to make like LGBT people feel like sex positive we discuss about sex. And I think we will also like try to adjust our language to different audience, like not because we share U equals U not only to the LGBT community but also to the general public. So we will try, and also to some medical professionals, the healthcare providers. So we will, based on the situation, to change our languages. And like I want to also mention about like when we talk to the medical healthcare providers, actually many of, I mean, based on our experiences, like 30% or like 40% of them don't know about the U equals U concept. So when we discuss with them, they will understand more. But sometimes some healthcare providers will still have this kind of, will still have like a fear of HIV. And I think it's important that we not only just to share about the scientific knowledge of U equals U, we also discuss with them about like how the fear comes up. Yeah, so that we want people to feel to understand or to think about like what's the fear of HIV comes up, so that we can go through deeper, and then maybe we can let more people to understand about it. You don't need to be afraid of HIV, even if you are at work. Yeah. So, and can I also add one thing to my previous question? So the question about like how to get are there like more people living with HIV coming out in the movement? I must say that for the younger generation, yeah, there are several, but they are not enough. But I want to add is that in based on the experiences of the marriage equality movement, actually I found that it is important for LGBTQ people to come out, but it's also very important that we have strong allies from like straight community. So we not only need LGBTQ people to come out, we also need straight allies. So also in the HIV movement, we not only need some people who are like brave to come out. We also need like more people to come out to say that, yeah, I support people living with HIV, and I want to share about the correct knowledge. So I think that it's very important for us to do the movement. Thank you.
Thank you, Sean, for that addition as well. Talking about, so we have Vietnam and then also in Taiwan talking about different I guess campaigns for certain populations and being provocative, sex positive. And then, we hear from Billy about, or can I come inside, talking about, being provocative and sex positive, and ensuring that is a thing that community is talking about. And I know that this is very much a campaign that is talking within the community. And even that there was you mentioned about the backlash, about the way that has been received by some people. Can you talk a bit about how did you then react to that, and were there strategies in terms of looking at countering some of these negativity, not just I think within our own population, but also from the general population as well?
There is, so the situation in Korea is that we have a huge human rights focused LGBT grassroots movement that many people are engaged with. Either they are building the movement themselves or they're following the movement at least. But there is also the general LGBT queer population that don't know this portion of the community exists. So what we hear is often a boombox or voice chamber of us just talking to one another and hearing feedback from like some other people. So usually when ideas or like topics come up that kind of goes against what we're trying to say in a very backward manner, we just kind of ignore it and just do whatever we need to do. We often think, especially with those provocative messages, is that if we get that fuel and like if we get that energy from people, whether that be positive or negative, we are doing the job getting the message out there. So that's how we kind of veered away from getting entangled in a lot of like online fights, essentially. But other than that, those kind of fueled us to really look into like how to really sculpt our language so that more people will be more palatable and accepting of the language itself when we do a little more of a broader campaigns. But that Can I Come Inside obviously was targeted at MSM, so that's what happened.
Thank you for the explanation.
I'm done. Thank you.
Raymond, I'm coming to you. I know you didn't present a campaign, or there is a campaign national level in Malaysia, but you mentioned about there's all this other programmatic work around, getting people to test and being on PrEP. And whether those campaigns that are looking at reaching people to come into the services, are they sex positive, and what were the processes of getting the messages across to those that are being reached to bring into services?
Sorry,
Raymond, can you hear me?
Raymond, can you hear me?
No, can you repeat that again, please?
Yes, of course. My question to
you
you
hear
is
me?
that
Yes,
in
of course.
Malaysia,
Yes.
there are programmatic work on targeting people to do PrEP, for example, or to go into HIV testing. The process of doing the advertisements or the campaigns to reach the populations, were they the same thing that has been explained in Taiwan and then in Vietnam?
Sorry, I couldn't hear you again. Sorry, I'm going to try to mute again. And can you sort of repeat again? I'm so sorry.
No worries. No, I should be sorry because the technology is not working. My question is that, are there any campaigns in Malaysia that is looking at sex positive and engaging the community to do the outreach through this messaging that's more positive, even though there is a lot of disenabling environment in Malaysia?
Okay, great. Yes, we have done quite a few on our side, and they're all sex positive. And I totally agree with Sean and Billy that any of the communication that we do towards key populations like MSM has to be entertaining and slightly provocative. And we find that when we do campaigns like this, on video campaigns like this here, it goes viral. Our concern, though, is that when it goes viral, it also lands in the inbox and social media of a growing number of Muslim NGOs. They're called Muslim NGOs, but often the source of funding is suspected to be from government sources, and their main existence seems to be to hunt up for all these video campaigns, as well as to get the Muslim population to respond to it and to say that how can something like that be happening in Malaysia? Why is an organization like PT Foundation, which is receiving funding from the government, promoting campaigns like this here? It is not good for Malaysia, for our youth. And when that happens as well, we have a big segment of our population who are MSM, Malay, and Muslim, and they feel very stigmatized. And when this happens as well, they withdraw further in. So it becomes very difficult to reach them. And unfortunately, these are the populations that are getting infected. And these are the same populations that are not coming for treatment because they're just too embarrassed and ashamed to get treatment. And they develop AIDS and all that. So we are in a very challenging situation in Malaysia. On one hand, we know that that is a way to do all kinds of communication campaigns, edutainment campaigns for MSF population. But when we do things like this here, we get a big backlash. So big challenge.
Thanks, Raymond. We're coming nearly to time, so I'm going to give everyone on the panel last word. So if you could talk about what is your plan for 2021, particularly on the U equals U campaign that you're doing. For you, Raymond, is actually about what then could be done, I suppose, even with the assembly environment. That could be a kind of a regional call, even for just for funding for Malaysia. And just kind of like give maybe if there's anything for other countries in this region that don't know where to start about U equals U campaign, what could they do, or what are your tips of what not to do, and what are your tips of what to do more of from your experiences? So I'll start off with Asia from Vietnam's experience.
Thanks, Midnight and the whole team. So I kind of teased a little bit in the presentation. In the next phase, those gaps. So we're seeing just in terms of bio literacy data, other program data, the healthcare providers are still not completely comfortable with talking about U equals U and how it relates to positive health outcomes. So we'll be working with the government and communities to develop like more tailored job aids for them. We're also, going back to our, leading community organizations and asking them where are the gaps. And so right now there's a lot of misinformation really about how K equals K, like how to get it, and confusion around PrEP. So tailoring those pieces and addressing those gaps. More broadly, we are going to go to the status neutral approach and really marry this idea of ARVs for prevention between the PrEP and the K equals K sides to say that if you take ARVs, there's no need to worry about HIV whatsoever, and really using that and how to into another national campaign and really enshrining that in policies and really enshrining that in the way we talk about HIV and the way we provide services, this idea of a one-stop shop. Mainly what I would just say as some advice is, there may be compromises you have to make if you work with different audience. They may need to have certain messages to get buy-in from the ministries or from their leadership, but then also to respect the community and what they want to do. And if you have the sufficient resources, then you can support both and they're not actually in contradiction with each other as long as there's dialogues happening between both sides. So we made sure that a lot of the materials we developed had the buy-in from the community and had the buy-in from government. And so that we were kind of speaking with one voice on those broad strokes. And then really just giving the freedom to communities to say and do and create and innovate. And I think that's incredibly important. And what we found with supporting CBOs with even just a very small amount of money is that they can create so much amazing content and it's owned by them. And that's ultimately what's most important. And I will end there.
Thank you, Asia. Sean?
Yes, I think for our plan 2021, now we are discussing, but I think the first thing that we need to deal with is about the misunderstanding of U equals U within the gay community. So as I mentioned, that still some gay men don't believe this kind of scientific knowledge. And also the second thing is that we need to have more dialogue with the healthcare providers. They are the one who can deliver like correct information and message. And also they are the one who can provide like treatment to HIV positive people. So I want them to understand U equals U more. And the third part is that, as Billy mentioned, I think that HIV stigma really plays like a huge role in this movement. So we need to deal with HIV stigma while promoting U equals U. And how do organizations or how groups started to provide to do U equals U. Sorry, I'm in my office. Yeah, so yeah, so how do groups or activists start to do the U equals U campaign? I think the easiest thing is that to translate the materials. There are already a lot of materials online and from like UNAIDS and other like international organizations. We just started to do translation first, and then we can develop our own. And as I learned from today's event, yeah, we have like government such as Vietnam who strongly supports CBO and also strongly for support for K equals K campaign. And also we have like Taiwan, our government just like in the middle, who are afraid of like being like get attacked by the anti-LGBTQ groups. And also we have like Malaysia and like Korea who just puts more efforts by themselves. And I think we just show that we can always do U equals U campaign no matter like how much resources we have. Yeah, so just find our own way. And yeah, and I think it's great that we can share about our materials with each other. Yeah, thank you.
Thanks so much, Sean. And Billy?
Oh, hi. So our next steps is actually repealing Article 21 for last and for all, which is the one that criminalizes HIV transmission in Korea. So it's really odd. A judge thought that this a judge saw a case where somebody was put against that article and thought this is unconstitutional. So the judge put in an appeal that this should be repealed. It wasn't the activists who did that. So we have been talking with that process to provide as much scientific information to the Constitutional Court to move towards repealing the criminalizing act. And then so with the whole COVID situation, what happened is that CDC in Korea, which used to be under the Department of Welfare and Health, actually became an independent office under the government. So they have been promoted, and they are actually putting out some information, at least, albeit it's just a paragraph on U equals U on their webpage. So we are trying to build a newer relationship where it does not have to be under a different government department, but their own independent department, and to talk about how they could be engaging the public health officials about infectious disease, especially in the era of COVID-19, about how to destigmatize infectious disease, including HIV. And then the tips, I think I really echo what Sean is saying, is that hold seminars on consensus statement. I think that is one of the biggest ways and easiest ways to start a conversation in whatever organization you're in. And that's how it started in Korea too, that we had a translation session and then we held our own seminars about difficulties in that translation. And then I believe that there are a lot of scientific articles that are linked to the consensus statement. And those were actually translated. And now that is being used as material to repeal Article 21 right now. So those are very important resources that we need to capitalize on so that we can actually advance the lives of people on the field. Thank you, that's all. Thank you for the opportunity to be part of this, actually. Thank you.
Well, thank you. I'm really glad that you're able to join us, actually, Billy. And then Raymond.
Yeah, okay. I think the situation in Malaysia, as I painted it, is very challenging, and it can get easily demotivated, demoralized with the situation. But we've been around for 30 years. We're not going to give up. We're going to keep trying. And I think strategically, it would be easier to go for the low-hanging fruits than to go for things like legislative reform. That's not going to happen, I think, not in my generation in Malaysia. I hope I'm proven wrong. So I think the social media space have the most excitement for us. I think we are already working with a lot of young people to do content development, to help us with digital marketing, to maybe go into areas of digital marketing in a more creative way so that we can engage with these populations more specifically to do all these kind of edutainment campaigns that we need to do. But we, at the same time, cannot lose track that all of these things would need funding, and we will continue to work with allies, funders. But more importantly, in Malaysia, being where funding from international sources are very limited, government sources are not there, we need to look for sustainable forms of funding. We already are seeing fruits running our own sexual health clinic, and that's sustainable. We will be doing a lot more social enterprises in that direction to hopefully be able to have a social media, social marketing arm that can communicate issues like you is equal to you. That's where we're heading, I think, in the next 2 years. Thank you.
Thank you so much, all the panelists, and I know that Kota would
Thank you
also
so
be able
much, all
to
the
add what
panelists. And I know
he's
that
been talking about around
Kota
the
would
U equals U, the campaign that he showed to us
you.
that they're actually launching very soon. So actually be following up with him in terms of what was the launch like and what will happen and what was the processes of going through that creatives and thoughts around that, and that will be featured in the AppCom's newsletter, which goes out to 8,000 subscribers. So I will also be reaching out to each one of you panelists, Asia, Sean, Billy, and also Raymond, about what are the movements, particularly around the community engagement on campaigns in your countries. I wish we had more time on this session, and I know it's actually quite a long session because of all the technical issues. So I would like to acknowledge people who are still online and still being with us, and even some people here in the audience. Thank you so much, Asia from the US CDC in Vietnam, Sean, the Taiwan Tongji Hotline Association in Taiwan, Raymond Thai, PT Foundation in Malaysia. Billy, I want to say a special thank you because you're actually stepping in for Youth BLJV Community of Korea R at a very short notice, and I was very encouraged to see there's a lot of communities that really want to share their voice and being available for us to hear your stories at the RRRAP Con 2020. So it's our privilege that you have been able to share the stories of what's happening in South Korea, and we look forward to engaging with you further. Thank you to Raymond as well, even though you might think there's a lot of this enabling environment, but I hope we could all be with us together. Challenges in different countries that we have seen, even in countries that have got marriage equality, there's still criminalization of HIV transmission, for example. So I think there are those challenges that are more community level, dealing with the more policies, governments, and then also criminalization as well. And a special thank you to Kota as well for doing the pre-recording. They are having their own consultations, so that's great that he was able to provide that. And I also want to thank Bruce Richmond of Prevention Access Campaign. He's been with us during the U equals Youth webinars all this time, and it's what, 11, 12 hours difference at times, and he is always a champion, obviously already working and already sharing his experience and passion and why he's doing this in some of the countries that are already on the panels. I want to also acknowledge the reason that we are having this session is because we were supported by many other supporters. So I want to specially acknowledge the IAS, particularly the Educational Fund, Gilead, and also with Healthcare for ensuring that we're able to have these kind of discussions and have these kind of platforms to connect, to innovate, educate, and then I guess to also ensure that we also move ahead in 2021. Thank you all for joining us online. Our next session is at 4:30.